My presentation is on the multi-state outbreak of human Salmonella Schwarzengrund infections linked to dry pet food, and my name is Grace Juong Kim. This is for Public Health 2. Step 1 is the background. Multi-state outbreaks of Salmonella Schwarzengrund infections in humans were reported to the CDC. There was a total of 70 cases of the infection in a total of 19 states. And the source of infection was dry dog food from the Pennsylvania pet food manufacturing plant called Mars Pet Care US. 62% of the infected individuals own dogs, and the rest of the infected individuals reported to have regular contact with dogs. Symptoms of infection included illness, diarrhea, fever, and abdominal cramps. Step 2 is the current situation. The problem that needs to be addressed by this case is the illness linked to contact with Salmonella Schwarzengrund infected dry dog food, dog stools, and dogs who have eaten this infected food. The strength is that the household exposure and environmental investigations were performed so the source and the mode of the infection could be determined by the outbreak strain. However, the weakness is that the dispersal of infected dry dog food is all over the United States. The opportunity is that the publicity of this infection and the Mars Pet Care US's voluntary withdrawal of select bags from 2 brands. The threat is that not all of the contaminated products are recalled and the chance of infection is kept constant. The mission statement of the collaboration of CDC, PADOH, and the FDA is to investigate and pinpoint the multi-state outbreak of Salmonella Schwarzengrund infection in humans, halt the production of the infected dog food, and inform the public on the dangers of coming in contact with the infection. Step 3 is prioritizing core issues. In 2007, 70 individuals were infected. Most of the infected were an average age of 3 years old, and 39% of the infected were infants. The Salmonella Schwarzengrund infections were caused by exposure and ingestion of germs from infected dry pet food, pets who have consumed this infected food, and the feces of these pets. Infections lead to issues such as diarrhea, fever, abdominal cramps, acute illness, hospitalization, and possibly death. Infections have not been reported to have any negative impact on the infected pets, but they do cause illnesses in exposed humans. So we need to prioritize protecting those with weaker immune systems, such as infants, children, and the elderly. Step 4 is analyzing the alternatives. The case solution is publicizing and educating the public on FDA's safe handling tips for pet foods and treats, and withdrawing all identified contaminated food. The social ecological model is promoting health by modifying pet owners' behavior, such as washing hands immediately after handling pet food, improving environmental threat of dog stool in public places, and the ecological approach of being careful with interacting with dogs. The alternative solution is to develop strict health guidelines for all pet food production companies to ensure that no future production of pet food is contaminated. The second alternative is to take all animals that have consumed the infected pet food to their healthcare providers for a checkup and treatment. Step 5 is recommendations. The first recommendation is to ensure that the public is educated in CDC's recommendation and everyone washing their hands for at least 20 seconds in warm soapy water after interacting with any dry pet food or treats. The second recommendation is to keep infants, children under the age of 5, and the elderly away from pet feeding areas and not allowing them to handle or touch dry pet food. Step 6 is the action plan. All people who have pets, people who come in regular contact with pets, and healthcare providers should be involved in this effort of eradication of Salmonella Schwarzengrund infections in humans through contaminated dry dog food. A goal should be made by year 2025 to ensure that there is absolutely no Salmonella Schwarzengrund contaminated pet food in the United States. The first step is to publicize and educate all pet owners to wash their hands after handling pet food and keep pet feeding areas away from infants, children, and the elderly. This should be done by 2018. Require all pets who have consumed infected dry dog food to consult a healthcare professional for checkup and treatment. This should be done by 2019. Call back all products produced by the Mars Pet Care US's production plant in Pennsylvania instead of only select bags to ensure that there is no more contaminated food spread throughout the United States. This should be done by 2020. Create strict health guidelines for pet food production companies and conduct required annual investigations in these production plants. This should be done by 2025. So by 2025, all Salmonella Schwarzengrund infected dry dog food should be eradicated, and the policies should be integrated to ensure that this outbreak will never happen again. So my opinion is based on this data that human illnesses have been linked only to the Mars Pet Care US's dry dog food, and that the CDC stated that not all contaminated food was recalled. So due to these facts, my opinion is that the Mars Pet Care US's production plant in Pennsylvania should be completely shut down to ensure that there's no dog food produced from that plant, and that will be further infected and distributed. Furthermore, I always wash my hands after interacting with my dogs and their dry dog food, and I have never gotten infected. So I think that anyone who interacts with their pets or pet food should immediately wash their hands after contact. These are my sources of references. Thank you and have a nice day.